Welcome to Search Ahead. We are back with our interviews to our colleagues in the field to learn firsthand from them how coronavirus is affecting their work. Today we will be interviewing Dr. Singatiya Chikumbanje, a specialist pediatric anesthesiologist at Queen Elizabeth Hospital, Central Hospital in Blantyre, Malawi. She is also the head of the Department of Anesthesia and Critical Care. Hello, Dr. Chikumbanje. Thank you for being here, and thank you for your time. How are you?
Thank you. I'm good, and yourself?
I'm fine, thanks. I would like to take the opportunity of having you here, as you are a specialist pediatric anesthesiologist, so you work with children, and children seem to have demonstrated in this virus that they have, or during this pandemic, that they have a natural resilience to the COVID. And how is, from the medical perspective and from your point of view, how is the virus affecting children and your work with them?
To say yes, they are resilient to the virus, the children, but being children living with adults, they are still at risk of getting COVID. And for them coming to hospital, the health-seeking behavior of children, it's actually the adult parents' guardian health-seeking behavior. They have to take their children to the hospital, which now with the slowing with COVID, people are more, they're not moving, they don't tend to come to hospital now. So I'll say there'll be a burden of disease awaiting us after COVID has settled. That would be mainly the impact on the children. And for us health workers, it's not just now looking at children, but we're also looking at adults who are COVID positive and trying to prevent the children from getting COVID.
Thanks for your answer. I wonder as well, how is the communication with the children? How are you developing the messages for the children? Is something that you are designing specifically for them?
I think children are easier receptive than adults. For children, if you tell them wash hands, they will religiously wash hands as opposed to adults. The messages we are giving out to the public are more tailored to adults as opposed to children. But you notice most children will pick up the messages, and with Corona, everybody talking about COVID and everything, children tend to be more forthcoming in the usual hand washing. Of course, social distance becomes difficult in children, especially if they want to play. You can't really control that. But yeah, at least the simple things like hand washing, they're able to do it by themselves. I wouldn't say the message is really tailored to children per se, but the messages will be the same. In terms of management, we as a hospital have set up areas where children who are suspected to be COVID positive, the suspected children are handled, taken care of while awaiting the results, and then they are managed as children, not as adults.
Children need their own style, definitely. And yeah, this is going to the anesthesia and your work as an anesthesiologist. You have been one of the SURG-Africa mentors, and you have been working in different district hospitals. Would you like to talk a little bit about your role?
You notice in Malawi, we guess a population of 18 million. We have only 4 physician anesthesiologists. And most of the anesthesia is largely provided by the non-physician providers, who we call in our setting anesthetic clinical officers. They have the skills and some basic knowledge of anesthesia, but they still need support from the physician anesthesiologists. So my main role was empowerment of the anesthetic clinical officers and advocacy for anesthesia equipment, for anesthesia drugs, for anesthesia in general when you go to the district hospitals.
Thank you for your answer. What would you say is the most relevant aspect of anesthesia that the SURG-Africa training has provided district hospitals with?
Okay, I think much as I talked about advocacy for anesthesia equipment, which will take time for it to materialize. But in terms of drugs, we've gotten there, and in terms of empowerment of the anesthetic clinical officers, them being able to do even the cases that they were not comfortable doing initially. Now with COVID, I think now they are able to handle such cases with the minimal drugs and the minimum equipment they have. In a sense, they have reduced referrals. I'll call them unnecessary referrals, patients whom they would ordinarily have referred, but now they are not referring those patients. So SURG-Africa has helped in empowerment of the anesthetic clinical officers, anesthetic team, in terms of them being more confident to handle cases they wouldn't have initially before.
Do you think this pandemic is going to bring some substantial changes in the health system, but especially in the district areas?
I always say, much as COVID is associated with a higher mortality and morbidity for a subsection of groups, but something positive will have to come out of COVID. And yes, I think something positive will come out of COVID, especially for the anesthesia, for the district hospitals, and the health system as a whole. Equipment has started coming in, and we'll see more equipment coming in, and drugs, and probably there will be more focus on health this time around after COVID, with and even after COVID. We'll give more attention to health care system and improve our healthcare system. I mean, COVID has exposed some gaps that we either ignored or didn't know were there. But with COVID, we are trying to identify and sort out those gaps that were there and try to improve our care for patients.
Well, with this silver lining, we stopped we just finished the interview. This is all for us. Thank you very much for having found an opening for this interview, for your time, and all the best.
Thank you.
Thanks to everyone for watching this interview. You can find previous ones in our YouTube channel. Next interview, it will be double interesting as we have 2 guests. If you want to know more details about it, check our social media. Take care and keep yourself safe.